To order. Welcome to meeting number 8 of the House of Commons Standing Committee on Procedure and House Affairs. Today is November 5th, 2020. And I'd like to start the meeting by providing you with some information following the motion that was adopted in the House on Wednesday, September 23rd. The committee is now sitting in hybrid format, meaning that members can participate either in person or by video conference. Witnesses must appear by video conference, and all members, regardless of their method of participation, will be counted for the purposes of quorum. The committee's power to sit is, however, limited by the priority use of resources, which is determined by the whips. And I think in committee business today, we're going to have to a couple of hurdles because of this issue that we can discuss. All questions must be decided through a recorded vote unless the committee disposes of them with a unanimous consent or on division. And finally, the committee may deliberate in camera, provided that it takes into account the potential risks to confidentiality inherent to such deliberations with remote participants. Today's proceeding will be made available via the House of Commons website. A reminder that the webcast will always show the person speaking rather than the entirety of the committee. And then to ensure an orderly meeting, I'd like to outline a few rules to follow. For those participating virtually, members and witnesses may speak in the official language of their choice. Interpretation services are available for this meeting. You have the choice at the bottom of your screen of either Floor English or French. Please make sure you select your choice at this time so that there's no delays once you start speaking. Before speaking, click on the microphone icon to activate your mic. When you are done speaking, please put your mic on mute to minimize any interference. A reminder that all comments by members and witnesses should be addressed through the chair. Should members need to request the floor outside of their designated question period time, they should activate their mic and say that they have a point of order. If a member wishes to intervene on a point of order, that has been raised by another member, they should use the raised hand function at the bottom of their screen. This will signal their interest to speak. When speaking, please speak slowly and clearly. Unless there are exceptional circumstances, the use of headsets with a boom mic are mandatory. Should any technical challenges arise, please advise the chair. And please note that we may need to suspend for a few minutes to ensure that all members can participate fully. Participation in person, proceed as you usually would when the whole committee is meeting in person in the committee room. Should you wish to get my attention, just signal me with a hand gesture on the screen, or you can call for the chair. Should you wish to raise a point of order, wait until the appropriate time to indicate that clearly and raise your point of order. The chair and I will maintain a consolidated speaking order. However, the speaking order for the purposes of the formal portion of today's meeting has already been given to me in advance. So if you want any changes to that, the members can just let me or the chair know, or you could just speak up at the time I call out your name. So let's get started with today's meeting. We're really pleased to have from the Government of Saskatchewan, Dr. Shahab, Chief Medical Officer for the Ministry of Health, and Dr. Denise Worker, Medical Health Officer for the Ministry of Health in Saskatchewan. And then from the Government of New Brunswick, we have Dr. Jennifer Russell, the Chief Medical Officer of Health for the Ministry of Health in New Brunswick. Welcome to all of you. We're really honored to have you. I know that we've got members from your provinces that perhaps may have gotten to know you, or at the very least, I think all of us have gotten to know you through our television screens, because we see you so often delivering updates for your various provinces. And we really appreciate the hard work that you've been doing throughout this pandemic. It's been a marathon, and I can't imagine how tiring it must be for everyone when working with the Ministry of Health federally and provincially. So we'll start with 5-minute opening remarks, and we'll start with Dr. Shahab. And please let me know if I'm pronouncing anyone's name a little off.
So thank you, Madam Chair. So yes, this is Dr. Saqib Shahab. Pronunciation was perfect. And good morning, Madam Chair and honorable members. Thank you for this invitation and opportunity. So I, along with my colleague, Dr. Denise Worker, who was the former Deputy Chief Medical Health Officer till August 2019, but thankfully agreed to come back from retirement and join us in the Office of the Chief Medical Health Officer as a public health consultant. We'll be speaking on behalf of Saskatchewan. I'll be making some opening remarks, and then we'll both be available for questions. So as per the written statement that we shared earlier, Dr. Michael Boda, who's the Chief Electoral Officer, Election Saskatchewan, approached me in February 2020 to ask about public health advice to support the planning and implementation of the provincial elections during the COVID-19 pandemic. It was anticipated that the provincial elections would be held in October 2020, and the CEO Election Saskatchewan had previously built a relationship with us in the Office of the Chief Medical Health Officer to address prior issues related to communicable disease control during earlier elections and by-elections. So we already had that working relationship. So it is my view and the view of my office that the provincial elections could be held in such a way as to minimize the risk of transmission of SARS-CoV-2, despite all the uncertainties about how the pandemic would actually unfold. So the initial advice from my office to Election Saskatchewan was to optimize voting by mail, to reduce crowding by increasing the number of hours of advanced polling and number of polling locations, to organize the flow of voters and processes of voting at polling locations to minimize COVID transmission risk, to implement additional transmission mitigation measures at polling locations, including hand hygiene, increased cleaning and disinfection, measures to promote 2-meter physical distancing to further minimize COVID transmission risk, and apply additional precautions for voting occurring in long-term care facilities and personal care homes. It was also recommended that Election Saskatchewan independently also contract an infection prevention and control specialist to provide direct support to Election Saskatchewan on many of these mitigation details. And we also agreed to plan for a worst-case scenario in which an election would remain feasible. In addition to the medical health officers and the Ministry of Health, environmental public health consultants were also available to provide input through a structured process to Election Saskatchewan on opportunities to mitigate transmission risk during the planning and implementation of the elections. The environmental public health consultants and the medical health officers provided guidance on proposed mitigation measures. We also facilitated operational connections within the Ministry of Health and the Saskatchewan Health Authority as needed, and were available to provide input to ad hoc issues throughout the planning and conduct of the elections. As Chief Medical Health Officer, I participated in regular meetings with the CEO Election Saskatchewan, and also had opportunity to visit a mock-up of a polling location before actual voting was held. As the Chief Medical Health Officer and as House leaders of the two main political parties, we were members of the Electoral Advisory Group, which was established by the CEO Election Saskatchewan. This Electoral Advisory Group convened monthly from June to September to review the state of the COVID-19 pandemic in Saskatchewan. So thank you, and both me and Dr. Worker will be happy to answer any questions.
Thank you so much, Dr. Shahab. Dr. Russell, please.
Good afternoon. So here in New Brunswick, the provincial election was held on September 7th and the writ dropped on August 17th. So that was a 28-day election period. And our role in Public Health New Brunswick was not to endorse whether an election should proceed. Rather, it reviewed the operational plan that was put forward by Elections New Brunswick and provided feedback to ensure agreement with public health guidance. WorkSafe New Brunswick also reviewed and approved the operational plan. Public Health New Brunswick provided guidance to all the parties on how to safely host public gatherings in terms of other activities commonly conducted during elections, for example, door-to-door canvassing. Public Health provided feedback on individual party plans submitted by parties, but never provided direction on what types of activities could or could not occur. Elections, New Brunswick followed public health guidelines to make visiting polling stations and returning offices safe for electors and election workers. Electors were asked to apply hand sanitizer as they entered the building. Frequent cleaning of high contact areas was conducted at all voting locations, and election workers were required to wear masks or face shield during their interactions with each elector. As much as possible, 2 meters physical distancing was practiced during electors' visits, and electors wore a non-medical mask at polling stations when physical distancing could not be maintained. The number of electors allowed in a voting location was limited. We also had the option to vote by mail. So all New Brunswick electors could apply to receive a mail ballot, and Department of Social Development worked with long-term care facilities to ensure ballots were provided and that there was no unnecessary election-related visitation to these vulnerable settings. And we also had advanced polling stations as well. So there are municipalities, the New Brunswick municipal elections will be held in May of 2021, and all of the best practices from the September provincial election will be built upon to provide advice for those elections. And it is hoped that the favorable conditions in New Brunswick during the past summer months recur in the spring for these elections. What is unknown is that New Brunswick is in a good position to contemplate its participation in a federal election, but there are aspects that remain unknown. New Brunswick has alert level phases, which dictate varying degrees of societal limitations ranging from yellow to orange to red phases. And New Brunswick red phase is as close as we come to returning to a lockdown. It's difficult to contemplate a region of New Brunswick being in an orange or a red phase with public health dictating that contacts be limited to those within a household while simultaneously gathering for an election. However, I did look up what the Public Health Act says around the New Brunswick Public Health Act says around this type of thing, and I believe that based on the authority that public health has to limit a democratic right would be something quite out of the range of the actions that we would be taking. And in terms of, yes, so obviously it would have to be quite a serious situation for us to ever interfere with the democratic process. So again, stopping an election probably wouldn't be in the scope or the range of things that we would do, but obviously in this particular election that we just had, we were in the yellow phase throughout the province. There were no active outbreaks, and we were fortunate that nothing like that happened during the election period.
Well, thank you to both of all three of our witnesses, and we'll start with our first 6-minute round. And I guess I just wanted to remind everyone once again too that there are so many questions with this pandemic, but our focus should remain within the scope of how they advised in running a safe election within their provinces and what advice they may have for running a federal election. So we'll start with Ms. Vecchio for 6 minutes, please.
Excellent. And thank you very much for everyone joining us. This is a really important topic, and making sure the safety of all Canadians while continuing to enfranchise them to vote is paramount. So just starting with Dr. Shahab, sorry about that. Following the election, did you see any increase in numbers in COVID cases caused by any gatherings or anything of concern like that?
So thank you for the question. We are following that very closely, and elections, the in-person voting ended over the last 2 weeks. So far, we have not seen any specific signals of concern. We have had one instance where someone was identified as COVID positive who had been at the voting site, but the way the protocols were set up was such that there was no one else identified as a close contact. And I think that's an important lesson for us in terms of the way we planned it, was that if we would have, for some reason, someone who may have been infectious actually going and either working, volunteering, or going to vote, the protocols are such that there shouldn't really be any situation where someone would be considered as a close contact or exposed. And that's what we saw in just one situation. Apart from that, we have not seen any signal of concern related to elections. And the way the polling was done, we would not expect to see that either. Thank you.
Thank you so much. And turning over to Dr. Russell, following the election that you saw, you have a few more weeks on that to be able to look at this and identify. Was there any increase in COVID cases following the election, or with all the protocols taken in place, did it come out rather safely?
There were no cases as a result of the election. Obviously, again, we're in a fortunate situation that we have not had very many outbreaks in total during the entire pandemic, and any of the cases that we have had for the most part over the summer months and into September were travel-related cases, and they were self-isolating and did not transmit to anybody else.
Thanks very much. I'll switch back to Saskatchewan now, and I just want to look at long-term care homes and places where vulnerable people would be going, such as the hospital and things of that sort. What types of protocols did you have for election workers who were going to be entering into those facilities? What additional protocols had you mandated?
So maybe I'll ask Dr. Worker to speak to those details as she was providing direct advice.
Thanks very much, Sakib. So Michael Boda worked directly with the Saskatchewan Health Authority, as well as the Ministry of Health branch that licenses personal care homes. So under the Elections Act, they have a requirement to enfranchise people in personal care facilities. That's under their legislation. But Michael Boda had to translate that to our legislation and how our facilities are licensed. So there was the election officials, administrators were considered critical workers, which meant that they could enter those facilities in the same way that other essential services could enter those facilities. And then what Elections Saskatchewan arranged was to have a central polling location, if that was feasible within the facility, or they arranged for what was called door-to-door voting. And in that circumstance, the election official would stand at the door, and the healthcare professional in full PPE would administer the ballot under the observation of the election officials. There was also guidance that the Infection Prevention and Control program for the Saskatchewan Health Authority developed for both hospitals and long-term care facilities. And this was generalized to the personal care homes, although the Saskatchewan Health Authority is not responsible for the policies in the personal care homes.
Thank you very much. I just a quick question for Dr. Worker. Because they were critical staff, were they also, did they have to be tested like other staff members as well to see if they had COVID or carried the antigen?
No, staff entering those facilities do not have to be tested before entering those facilities, but there are precautions in terms of the wearing of masks and physical distancing.
Perfect. Thank you.
And as I said, yeah, if there is close proximity with an individual, the election officials did not get into close proximity with those individuals. And if they set up a polling location, it would have been done under the same way as they set up if they set up a polling station, it would be done in the same way with physical barriers as well as physical distancing.
Excellent. Thank you so much. The reason I asked specifically about that was here in the province of Ontario, whether you are working in that facility or whether you are visiting, there is testing that is mandatory for some of these locations. So I just wanted to see where you were at. Dr. Russell, I had read somewhere about New Brunswick, because of COVID, they were trying to not do the door-to-door in long-term care facilities. I read this on one of, it was a place dealing with long-term care homes. I just want to ask you the same question as I asked Dr. Worker. What was the role of when it came to medical health officers with testing of anyone coming in that's working for the polls or anything of that sort? And what were the restrictions put into the long-term care homes? And as I brought up, Dr. Worker had indicated about door-to-door. Was that allowed in New Brunswick?
So we didn't make a distinction between door-to-door in an adult residential facility or a long-term care facility, et cetera. but each facility has protocols that reflect which phase of our response that we're in. So at that time, the province was in the yellow phase, which it means that they all have a certain type of visitation that is allowed, and it's limited to one family member usually. So door-to-door was not done anywhere in the province, actually, even though we didn't say that it couldn't happen, but there was no party that put an operational plan to do it. So there actually was no door-to-door anywhere, including long-term care facilities, et cetera. But I don't even know how they would have been able to based on the visitation requirements in the yellow phase.
Thank you, Dr. Russell. Next, we have Ms. Pettipat-Taylor for 6 minutes, please.
Thank you so much, Madam Chair. And I also wanted to take a moment to thank Dr. Russell, Dr. Worker, and Dr. Shahab for the tremendous work that you have done over the years. I know that specifically this year, I would think Canadians have a greater appreciation for the work that public health officials have done. And I can only speak for my province, Dr. Russell. I've watched you daily on briefings, and you've certainly done an exceptional job at informing New Brunswickers, educating us, and also reassuring us. So thank you to each and every one of you for the work that you continue to do. I'm going to focus perhaps a bit on Dr. Russell because I'm from New Brunswick. A few questions, I guess. First and foremost, what is your relationship with the Chief Public Health Electoral Officer, in the province of New Brunswick?
I'm unmuted now. I don't have any official relationship with the Chief Electoral Officer. Again, we provided input from a public health perspective around how to safely have an election. And again, it was very, very basic advice from the perspective of all the engagement sessions that we'd had early on in the pandemic when we were going through our phases around what businesses, what other establishments could do in different sectors of industry. So in terms of having templates all ready to go in terms of WorkSafe's involvement, it was very, very straightforward in terms of any of the types of activities, whether it's business or otherwise, that are happening in the province. It is how to do them as safely as possible, depending on what the situation is with respect to which phase we're in.
Great. And the province of New Brunswick was in a minority setting, just like we are here in, nationally within our federal government. And I'm wondering, when did the planning start, or when did the conversation start between your office and the Chief Electoral Officer in planning the election?
Well, I know initially during the first wave of the pandemic, and when it was clear that during the red phase of our response that many things would not be able to take place. So I remember the very first conversation around what things could happen and what things could not happen in the red phase were well before any lockdown actually happened. But certainly when the first lockdown happened in that first wave, it was clear that things like legal proceedings and elections would not be allowed at that time. So, but then as things evolved through the summer, I don't have a distinct timeline of when the first conversations happened, but we would have been contacted by the Chief Electoral Officer for our public health advice and input.
Great. Thank you so much for that. You also indicated that come the spring in New Brunswick, we're going to be having municipal elections in 2021. And from your experience with this last election in New Brunswick, what additional measures do you think could be put in place in order to guarantee even further public health measures and safety for people to get out to the polls?
Well, our public health advice, again, depends on what phase we're in, and we keep revising that. So the original red phase of lockdown is very different from our new version of that, because as we get new information and new data and the risks change globally and in other jurisdictions in Canada, we continuously take that new information, evidence-based information and data, and inform what our different phases will look like. So when the election took place, I don't think mandatory masking was in place. Mm-hmm. So whatever updates that we would have in terms of public health advice would reflect anything new in terms of revisions for the ongoing yellow phase, and in terms of, again, just information that we have received from either outbreaks that we've dealt with in our own province or things that we've seen, evidence-based information in other jurisdictions.
Great. And again, as you've indicated, we had a successful election in New Brunswick, I would say overall. Now, in the event that we would have had an outbreak, however, within our province during the election period, was there an actual protocol that was in place that you could provide to us with respect to information, best practices, guidelines that were prepared?
I don't think there was anything specific. Again, it would be the same type of guidance that would be for any operating business or establishment. So with respect to changing response phases because of an outbreak, in the most recent outbreaks, they affected only one zone at a time. With respect to an outbreak, we did happen to have two separate outbreaks concurrently in two different zones. But what that meant was the orange phase of response meant that certain businesses could not operate. We are revising that now, and the only other changes were around how many people could gather with respect to close contacts and household members. So technically speaking, that wouldn't necessarily impact all of the protocols that are in place for an election to take place, again, with the physical distancing and spacing, et cetera. As you know, you may or may not know, during the last outbreak in the northern part of the province in Zone 5, we did have and have had in other occasions mass testing. And so the physical distancing is in place, the masking is in place, the hand sanitizing is in place, et cetera. So there was nothing specific around that, again, because the protocols that would be in place already that are set out in our advice and recommendations and requirements for the orange phase, should there be an outbreak, technically would not impact all of the things in the protocols and the plans for an election.
Great. Thank you. That's all the time we have, unfortunately. Madame Normandin, 6 minutes.
Thank you very much. Thank you, Mr. Shahab, Dr. Worker, and Dr. Russell. I don't know either of you because I'm neither from New Brunswick nor from Saskatchewan, so I have general questions. Could we talk about the worst scenario cases or worst case scenarios? At one point in the preparation for elections or just before the writs were dropped, were there scenarios that meant that an election could not happen? I understand this can be very sensitive information, but what criteria could have prevented an election from taking place?
So who wants to go first?
So I'm happy to maybe start. Is that okay? So yes, I think that's a really important point, because when we first started having discussions with Election Saskatchewan, and we had a relationship with Election Saskatchewan in previous elections, we would always work with them. For example, elections frequently happen during influenza season, so there would be outbreaks in long-term care facilities, and we would work with Election Saskatchewan to make sure that voting occurs in a safe way, as described by Dr. Worker, for long-term care facilities where you have more vulnerable clients. And we, throughout with our electoral advisory group, which had membership from the political parties, we met monthly from June to September. We would actually look at our rates, which are generally low. We would look at rates in the rest of Canada, which are also generally low. And we would look at rates in other parts of the world. And we would say that, okay, if we had rising rates, what would we do? So our advice from public health was that you need to have protocols which would ensure safe voting. And so even if rates were high, we would be confident that you could go and vote safely. But of course, the question was, what would be the public confidence in terms of turning out, and what would be the confidence of staff in terms of working for Election Saskatchewan. And so Election Saskatchewan was actually very much aware of that. And my understanding is that they did a lot of work to encourage staff to understand the protocols, masking, infection prevention control, so that everyone felt safe, the staff, volunteers, as well as people coming to vote. Thank you.
Peut-être Dr. Worker, si vous avez des commentaires de votre...
Dr. Worker, do you have any comments to add?
Russell, pardon.
Dr. Russell, rather.
Oui. Alors, pour le scénario...
In terms of triggers for not holding an election, I think in New Brunswick, the discussions that we had really weren't to have discussions about avoiding an election or holding or not holding an election. It was rather centered on providing advice and advice about holding elections as safely as possible.
Une question que j'ai...
Thank you very much. I put a question to other elections directors. I asked them whether or not it would be useful to have the coordinates of voters, like some restaurants did in some provinces for clients. So I asked the electoral officers whether it would be a good idea to have these coordinates, to have the contact information in case it was found out that these voters, for example, were contagious. And it was also to trace contacts between voters. Or would it be worthwhile? Is the risk too low to make it worthwhile?
Tu demandes à nos deux ou Dr. Shah?
Who are you asking? All of us? Whoever would like to answer.
Yeah, maybe I can make some quick comments and Dr. Work can add to that. I think our premise was that the conduct of the elections, we know much more now about COVID than we knew in March. We know that people are most infectious, in the 2 days before symptoms and the 2 days after symptoms, and many young people can have many very mild symptoms. So we knew that testing and symptoms alone are not sufficient to promote safety during voting or any other activities in the public sphere that are essential, grocery shopping, other activities, going to school. So we were very keen, along with Election Saskatchewan, to make sure that the processes are such that even if someone was infectious, the risk of transmission would be minimal. But obviously, my understanding is that each polling location would have record of the staff and who work there on specific days. And I would understand would be able to either communicate through a public service announcement if there's a need to contact people who had voted there in person, or would have record of who voted in a particular location. But that specific question, I'll see if Dr. Work has further information on that, or Election Saskatchewan can confirm. But I would like to reiterate that the way it was done, even if we needed to do a public service announcement or reach out, the expectation would be that the process works in a way that there would be minimal infection to others based on physical distancing, mask use, hand hygiene, and other measures, the layers of protection already in place. Thank you.
Okay. Thank you, Madame Normandin. Thank you to the witnesses. Next, we've got Mr. Blakey, 6 minutes.
Thank you very much, and thank you for taking time to be with us at what I know is a very busy time for you in your important work. I wanted to start by asking, we know that the pandemic has affected different groups of people differently, and thinking particularly about Indigenous communities, people living with disabilities. There are other groups, and so I'd like your reflections, if you can, on how public health orders might present unique or different barriers to different populations who are already struggling with the pandemic in different ways, and if over the course of the elections in your respective jurisdictions, if there were problems that came up that you didn't anticipate, or if there were best practices or solutions that you found to some of those particular barriers that you'd like to share with the committee as part of our study. And we could start with Dr. Shahab, and then Dr. Russell, and Dr. Worker, if she'd like to contribute as well.
Thank you for that question. I think we worked very closely with Election Saskatchewan to, from our side, the emphasis was that the processes should be such that everyone, whether they are in an older demographic, have underlying risk factors, would feel very safe going for in-person voting. So that is essential. And of course, Elections Saskatchewan always ensures that the access to polling location should be available for everyone. Beyond that, we did recognize, though, that many people would feel more comfortable voting by mail. So I understand overall voter turnout was strong in Saskatchewan, and there was a much greater proportion of people who voted by mail. Plus, there were more polling locations numerically and more pre-polling opportunities. So all of that contributed to thinning out any sense of crowding. But the protocols are such that there shouldn't really be any crowding as such. There was good separation. But I think the perception of that was very important, that individuals felt comfortable voting either by mail. There was lots of opportunity to do that. I think as early as August onwards, that opportunity was there to register to vote by mail, and also to go either before the election date or on election day to more polling locations than normal. Thank you.
Thank you. Dr. Russell.
Hi, so to Dr. Shahab's point, we had advanced polls and we also had mail-in options. So that definitely gave a lot of flexibility for people who wouldn't necessarily be able to vote on election day. The only complaint I had heard, I think there was wheelchair accessibility issue in one of the polling stations, and I think it was one of the advanced polling stations, so that was addressed.
Okay, and in the case of Indigenous communities, were there, and particularly where there might be travel bans in effect for public health orders, did anything come up in the that you were asked to address in terms of how some of those public health measures impacted people's ability to vote?
For Indigenous populations here, there was nothing that would have prevented anybody here from voting in that way, although there was a recent election on the Quebec side of our border, and we did actually give exemptions for the New Brunswickers who needed to go across to vote to do so.
Thank you. And in Saskatchewan?
So in Saskatchewan, during the election period, some First Nations had, because they had jurisdiction to limit, non-essential visits on reserve. So they had the option to either have polling locations on reserve or to work with Elections Saskatchewan off reserve. Public Health itself did not have any travel restrictions during the current elections in October. In July, we had an outbreak in Northwest Saskatchewan, where there were some travel restrictions for non-essential travel, but travel was allowed for all residents in the Northwest. In Indigenous communities and non-Indigenous communities, travel was allowed for other essential reasons like grocery shopping or medical visits. And if elections had been during such a situation, I would have suggested that travel should be allowed for voting purposes as well.
So beyond the question of access to voting stations and being able to mail in your ballot, another really important component of the conduct of an election, obviously, is campaigning activities. We've heard that different things have happened in different jurisdictions in terms of consultation and collaboration with political parties about best practices around campaigning. I'm just wondering if you can speak to whether you think it's important that there be some kind of body set up with recognized parties in order to discuss those things in advance and come to some understandings, and how that unfolded within your respective jurisdictions. Although I know we're very short on time, so maybe if you could just let us know if you think it is a best practice that there be a body with political parties to discuss campaigning methods, just a yes or no for each jurisdiction, and I hope to return to this at a later question.
I would say yes, but I would like to say that was not seen as the responsibility of Elections Saskatchewan. And any questions we received in public health, we said we need to follow the general measures. So door-to-door canvassing in Saskatchewan was allowed, and all the guidelines should be followed by political parties. And certainly the meeting limits of 30 indoors and 30 outdoors were in place that should be followed. But because any jurisdiction can be in different phases, that would be an important thing regarding campaigning before an election.
And Dr. Russell?
Dr. Russell?
So again, to Dr. Shahab's point, we did not say that door-to-door canvassing was not allowed. Again, we were in the yellow phase at that time, and we just gave guidance on how to do it safely.
Okay, thank you. Next, we've got Mr. Tucker for 5 minutes, please.
Thank you, everybody, for attending today, for our witnesses, and more importantly, thank you for your public service during these trying times. My questions, a little bit first off to Dr. Russell. You talked about the different colored phases, and in Saskatchewan, we don't per se have a colored phases on there, but I'm interested to know, early on in the year, you were talking about how it was evolving. We were trying to figure out what we were facing, and I believe it was the red phase that I believe your province was in. And just to clarify, it's during that phase you wouldn't recommend, as much as I know you don't have power over federal elections, but provincially, your recommendations would hold a fair bit of weight with the election officials. Would your advice then be not to have an election then, if I'm hearing you right?
Well, again, I went through the Public Health Act to see what powers we have under the Act to use, our judgment around what things are safe and what are not in different situations. And my understanding is that we would not really be stepping in to interfere with the democratic process. I doubt very much that anybody would decide to hold an election if we were in a lockdown red phase. So I think in terms of the fine line between who decides and what should be done or not done, again, for the most part, public health stayed out of those decisions, and we just really offered our advice about, if you're going to have an election, this is how to do it safely. I think the only question would be, would we give different advice on what that safe way of doing it would look like in red and orange? I think so, absolutely.
So, appreciate that. And Dr. Shahab, thank you again for being here today and all the work you're doing in our province. There was consideration and public conversation about perhaps a spring election. And I think with the leadership of Premier Moe, and decided that it wasn't worth the risk to hold a snap election for somewhat partisan reasons, and to what happened was that we followed the election law in Saskatchewan, and the election took place on the scheduled time. To Dr. Shahab, were you relieved when that statement came out in the spring?
I think I would see my role as to support Elections Saskatchewan whenever and the government called an election, and Elections Saskatchewan was required to conduct an election. So I would support elections during any situation. And in spring, we knew less about COVID, but we certainly knew enough about basic measures. And certainly our rates at that time were mostly due to international travel. And of course, the dynamics of COVID have changed. But I think I would have been happy to support Elections Saskatchewan and the province of Saskatchewan whenever an election would have been called.
So it would have been, just to make sure I'm hearing you right, so depending on what stage we were in, there'd be different restrictions or different advice given on how to handle a safe election. Is that correct?
That is correct. And if I may just add that, I think Canada generally, although we've had increasing cases throughout Canada, we have been fortunate so far not to have seen cases which parts of Europe and the US have seen, which are 10, 20 folds higher. So I think it's difficult to visualize that would our recommendations be the same if we had cases 10, 20 times higher. I think certainly the way you go and vote is still safe, even when you have very high cases. But I think public confidence may not be that high, and the confidence of volunteers and staff may not be that high. That's the only thing I would like to say in terms of thinking for holding an election with much higher rates than we in Canada have fortunately not seen so far. Thank you.
Right, and I appreciate that you have a kind of a set number that you kind of follow policy. Like we in Saskatchewan, we just had a series of days that were over 60, and Dr. Shahab has stated in previous months that that if there was increased load such as we were experiencing, that we would have to consider other measures. And I appreciate that you have kind of a number in your head. Sometimes it's public, but sometimes it's not, and we all have our different roles to play and why that would be released or not. But was there a number that, or in your mind, that was a no-go in Saskatchewan for election?
Again, I would say that we in Canada have generally been using thresholds of 5 per 100,000, which for Saskatchewan is 60. And where in Saskatchewan, I have said that I will really start getting concerned in terms of if there's a general increase, and then 10 per 100,000 is 120 cases. But again, the thresholds of which specific measures have to be taken have generally been in Canada and other parts of the world at much higher levels, and they really have been. Initially, they have been more on slowdowns or lockdowns, but as we learn more, I think we can be more confident that a lot of activity, whether it's business or leisure, can happen as long as specific guidelines are followed. And the real risk really is in where interactions are not controlled, whether that's in leisure time or in workplaces where there's crowding, there's lack of attention to physical distancing, mask use where required. Yeah.
Thank you, Dr. Shahab. Mr. Turnbull, 5 minutes, please.
Thanks, Madam Chair, and thanks to all the witnesses for being here. Really appreciate your expertise and all you have to contribute to this important study that we're doing. So thank you, thank you, thank you. Mr. or Dr. Shahab, I know when I read your remarks in advance and when you made them today, would it be fair to sort of summarize your overall remarks as, avoid crowding and spread the election out in both time and space? Would that be fair to say?
Absolutely. I think, the ability to use remote voting like mail-in ballots or other technologies would be very important as much as feasible. And then for in-person voting, absolutely spread it out, more locations, more time to do pre-polling and polling. Thank you.
Great. So if I were to ask you some short questions, so if I were to say from a public health standpoint, would you recommend more polling stations or less?
More.
And what about more advanced polls or less advanced polls?
More.
Okay. And a longer writ period or a shorter writ period?
So I may not understand all the dynamics of a writ period, but certainly if that relates to pre-election activities, I think I would say I would hesitate to suggest longer or shorter. I think, but pre-election activities have to be generally safe, and if in a part of Canada or a part of the province transmission rates are higher, they may have to be further curtailed depending on the transmission risk.
Right. Yeah. I mean, the writ period is just the election period. So if we have more days, we spread things out, have more. So I think it's consistent with the other things you said, but I'll leave that for the moment. In terms of vulnerable populations, we've heard that seniors are more at risk during the pandemic, the immunocompromised, people with underlying health conditions, people with disabilities, people who are lower income, people who are indigenous, et cetera, et cetera. I think there are many other groups. Have I missed any major groups that you would think are vulnerable?
No, I think those are the broad categories: age, underlying risk factors. But certainly, rarely COVID-19 can have serious outcomes even in the young.
Okay, and would you say that vote by mail is essential for people who present a slightly higher risk as a tool for elections?
Our recommendation and the protocols we had would have made it safe to vote in person or by mail. But voting by mail, I think, lends confidence to those who would rather vote by mail, and also decreases the crowding, even if you have more polling locations and more pre-polling.
But for people who have legitimate concerns about going to a polling station and know that they're at higher risk, would you not recommend that they vote by mail if there's that option?
Yes, especially if transmission is high. Vote by mail or other remote methods, if available, I think increases confidence.
Okay, great. And I know your electoral advisory group was meeting quite regularly and was quite effective. Would you say that's kind of a best practice
I think that is very important to look at scenarios that may unfold and how would we continue both in the pre-election activities and polling. That's very important table, I think.
Great, thank you. And in terms of ideal site selection for polling stations, were you involved in developing any criteria for that?
Yes, when we did the mock-up, I think there was good discussion that instead of, for example, having 6 lines in a room, you may have just 2 voting lines to spread everything out, and that led to more polling locations. We had discussions about can they be in a school, because schools had also started, and we thought yes, you can separate out schools from the actual voting process. And I think in many, if they were in schools, school was not in session that day, but that also generated the selection of many non-school based polling locations as well.
Would you be able to table anything for this committee in relation to site selection from a public health standpoint?
I could work with Elections Saskatchewan because we worked on that together. Obviously, they were recommended. Yeah.
Thank you. Yeah. And my last question is about communications. You mentioned reassuring the public, and there's definitely a perceived risk out there. We can make these sites secure and safe, but we also have to let the public know that they can have confidence, right? Would you say that public health has a lot of experience in raising public awareness in terms of campaigning? Yes or no?
Very quickly, yeah.
Yes.
Great. So should they be involved in informing messaging and communication strategy?
I think we can assist in promoting safe pre-election and election activities.
Thank
you so much.
Madame Normandin, 2.5 minutes.
Merci beaucoup. J'aimerais.
Thank you very much. We've heard the electoral officers tell us that the people working at elections were younger this year. Did you make any recommendations to the electoral officers so that they would choose people who are younger and who are less at risk? Dr. Shahab? First, Dr. Russell. We did not necessarily recommend that people be younger or less at risk, but I think people self-selected as to whether they participated or not. All right, Dr. Shahab, is that the same answer? Dr. Shahab?
Yes.
Seconds back on.
Yes. We wanted to make sure the protocols are safe for anyone older with underlying risk factors or younger. But we also realized in Elections Saskatchewan, I think also realized there may be less interest for some traditional staff and volunteers who are older. And then I think they also reached out to younger. But the processes, we wanted to make sure that it doesn't, irrespective of age or underlying risk factors, it should be safe.
Merci beaucoup. Vous avez parlé de l'importance d'étaler le nombre de jours de vote pour qu'il y ait moins de gens en même temps qui votent physiquement. J'aimerais savoir, est-ce que c'est une idée qui pourrait être appliquée, par exemple, de recommander aux gens, si votre nom de famille commence par A à F, allez-y le samedi. Si c'est de telle lettre, allez-y le dimanche pour mieux répartir. Est-ce que c'est une idée qui pourrait être à considérer?
Moi, je dirais oui, mais je crois que le message aussi, c'est de prendre davantage le processus d'avoir le
Point of order.
Is to have a process. Yeah.
Again, and we'll see how it works. Yeah.
So, to answer the question, to minimize risk, people can vote through the mail. That would be the safest way. And as Dr. Shahab said, if you can vote earlier, that would also be a way of reducing the number of people voting on Election Day. maybe Dr. Shahab on the idea of telling people to vote on such a day if their name starts with such a letter or with such another letter. Would that be something to consider?
I would not be able to comment. I think having too rigid a protocol may reduce voter turnout.
Thank you, Dr. Shahab. Next, we've got Mr. Blakey. Please, 2.5 minutes.
Thank you very much. I think we've heard in our testimony so far that even in the event that the voting process itself is safe, provided that directions are followed as they should be, that in the event of an extreme outbreak, people's confidence in the safety of the process might be shaken. And I'm wondering, in your opinion, who it properly belongs to make a decision or a call about at what point, even if the public health orders are good and would permit a voting process that's safe from a health point of view, at what point it would not be appropriate to have an election for fear of the fact that voter turnout would simply be too low because people are concerned or worried about their personal health if they engage in that voting process. Who do you think it is that ought to make that call? Is it public health officials? Is it election authorities? Or is it the political side of the equation?
So maybe I can start that. It is about thinking about the unthinkable. And if we had a situation which we in Canada have not seen, some parts of the world have seen, where ICUs and hospitals are overrun, and there's quite a lot of concern, I think certainly it would be up to the government and the Elections Saskatchewan to see the feasibility of conducting elections in a situation where there may be very low voter turnout. And the role of public health would be to intervene if elections were being conducted in a way that was not safe, which should not be happening either when case rates are low, like they were in Saskatchewan, or when they're high. The process should be safe in any case. Thank you.
Dr. Russell, where do you think that decision ought to be made? With public health officials, with elections authorities, or is it really on the political side that a call has to be made about the risk to turnout and, by implication, the legitimacy of the election? Is that something that politicians decide, or is it somebody else?
I don't think it's public health because, again, our advice is how to make it safe. So in terms of the voter confidence, in terms of how safe it is, obviously the mail-in ballot is a very safe way to vote. So again, we can only give our advice about how to make it as safe as possible, no matter what the setting is in terms of outbreaks and cases.
Thank you. Mr. Doherty, 5 minutes, please.
Thanks, Madam Chair. Dr. Shahab, Dr. Worker, were you consulted by the Premier on how elections should be conducted in the context of a pandemic?
My recommendations were only provided to Elections Saskatchewan, and any discussions that happened further to that were on the Electoral Advisory Group, where the leaders of both political parties, House leaders of both political parties were present, along with myself and the Chief Electoral Officer.
Okay. Dr. Russell, same question to you.
Sorry, Dr. Russell, you're on mute.
Sorry about that. I exchanged information in writing with the elections officials, but I know that we had people from public health working with elections, New Brunswick folks. The only conversation I had, the Premier did phone me at one point, and he did let the public know that I spoke to Dr. Russell and I'm comfortable holding election, but I didn't tell him whether to hold an election or not, but he just wanted the comfort of knowing that he was able to speak with me.
Okay. Dr. Shahab, you spoke of your electoral advisory board. Who comprised that?
That had myself and Dr. Worker from the Office of Chief Medical Health Officer. It was called by the CEO of Elections Saskatchewan, Dr. Michael Boda, and it had the two further members, the House leaders of the two main political parties.
How often did you meet?
We met once a month for 4 months, June to September.
And throughout the election as well?
We did not meet during the writ period.
Okay. And Dr. Russell, same question. Did you have an electoral advisory committee as well?
I'm not sure. I know that I had public health employees who worked on the official advice and would have interacted with the Elections NB employees.
Did both provinces, this question is to both of you, did you said you reviewed the plans of your electoral elections, New Brunswick, and elections, Saskatchewan. Did you periodically check in? Was there regional health officers that went, or public health officers that went to polling stations to make sure that everything was being maintained?
I'm not sure who would have done some inspections. We would have had public health inspectors who could have helped with that, but also WorkSafe New Brunswick inspectors could have helped. And again, in the situations where there seemed to be complaints or what have you, that there were people who did go to inspect. With respect to the plan, we did review the plan that was presented and did help make suggestions for improving it and changing it. And so again, there was collaboration in that way.
What type of complaints did you receive?
Well, the one I mentioned about the lack of wheelchair accessibility for one of the voting sites.
Dr. Shahab, same question.
Yes, we actually, because we had been involved for many more months than I think New Brunswick and BC, we were very confident of the plans and actually visited a mock-up. And I'm not aware of any specific issues during the election, but Dr. Worker may have some comments.
Yes, we provided input to the processes as Michael Boda adapted his processes for a safe election. We did not receive any complaints, and the polling locations were not inspected.
A question for both groups. Would it be your recommendation? Now, and I understand you don't inform political offices, but it would be your preference, obviously, not to hold an election during a pandemic?
You know, from my side, this pandemic is a marathon. We're in our 10th month, 11th month, and there'll hopefully be a vaccine in spring. But then some cautions will need to continue for another 8 to 12 months. So again, I think essential work, including elections, if it is a time of elections, probably need to happen. That's all I would say.
Okay.
Yeah, I agree with Dr. Shahab.
Was voting allowed in hospitals for long-term care? Folks that were, case in point, my father-in-law is in palliative care. I had a stint in the hospital. Voting was not allowed for him.
Dr. Worker may comment in some detail.
Yes, voting was allowed in hospitals. The election administrators were considered critical services. Individuals who had COVID-19 were not allowed to go down to the polling station. All of this was done under the Saskatchewan Health Authority Infection Prevention Control Guidance.
So that would be the door-to-door service?
Yes.
Thank you.
Thank you.
Mr. Algabra, 5 minutes, please.
Thank you, Madam Chair, and I want to welcome our witnesses, Dr. Shahab, Dr. Russell, and Dr. Worker, for being here. Thank you for your for sharing your insight with the committee. So we are looking as a committee at offering recommendations to Elections Canada in preparation for a potential election during the pandemic. And let me start by asking, where is the highest risk during an election period? Is it the entire writ period, or is it the actual days where people are gathering to go vote? Dr. Shahab, you can go ahead.
Yeah, I think so. It's your population transmission levels are higher, that then conveys a higher risk. Certainly, in my view, the highest risk at any time is importation of COVID into long-term care facilities. And I think the guidelines can vary during the writ period about gathering size and door-to-door canvassing. So again, I think it's a function of following the guidelines. And even if you're having a small gathering, 15 or 30 that is allowed in Saskatchewan, having that safely.
Dr. Russell?
I have to agree with Dr. Shahab again. Our goal with public health is really to be able to mitigate all the risks for any type of situation, and obviously following all the public health guidance in this situation is imperative, regardless of whether it's pre or during the election itself.
Again, this is a question to both of you, and maybe I'll start with you, Dr. Russell. Do you recommend a protocol for tracing for people who show up at the polling station?
I believe that all that information was captured, and that is similar to restaurants, et cetera, and any gathering. So that's very wise to have that information available. And certainly with more technology and the COVID app, that's another piece of technology that can be helpful and useful in this situation.
Dr. Shahab?
I would agree, and also the confidence that the process to start off with is such that even if someone was infectious and came to vote, the risk of transmission would be next to negligible, I think is an important piece as well. Thank
you. Okay, and again, I'll ask a question to both of you, and I'll start with you, Dr. Shahab. Can you offer advice if we're, as a committee, we're going to offer advice to political parties on campaigning? Can we do canvassing safely? And if so, what are the necessary requirements to keep the canvassing as safe as possible?
I think during canvassing, all the activities about, and for federal elections, interprovincial travel, meet and greet, all those things, I think, even though you minimize risk, the risk is never zero. So if there's always a small risk for any activity, but I think keeping it as low as possible is the goal of everything we do now. We're not in lockdown, but we go to work, school, socialize, go to restaurant, but we need to keep the risk as low as possible. It can never be zero.
So for local candidates, instead of just party leaders who are traveling province to province, local candidates like myself and my colleagues here and our campaign teams, if we were to go door to door, what is necessary to minimize the risk? You muted yourself back.
Our canvassing guidelines allow door to door and have for several months in a way that I would say minimizes risk close to zero. But we can't predict how individuals would feel about people knocking on their door. Some are fine, some feel uncomfortable, but certainly the guidelines would minimize any risk of transmission.
Thank you. Dr. Russell?
Just echoing what Dr. Shahab says, but it's true. That is very true. I think the only other thing, because this is an evolving situation and we do keep learning new things and we do keep having newer technologies available to us, we've started to do testing for essential workers recently every several days. And it could be that if we were looking at adding anything to consider, we could perhaps add testing the next time we have an election, depending on how things have evolved with that. So again, we're because the risks keep changing and evidence and research and technology keeps changing, we'll take advantage of those things to make things as safe as possible.
Thank you, Dr. Russell. Mr. Lukiski for 5 minutes, please.
Thank you very much. And first, let me say to all of the doctors present, thank you so much on behalf of all Canadians for the work that you've been doing. It's been extraordinary in these very, very trying times. And as a Saskatchewanian, Dr. Shahab and Dr. Worker, I'm very proud every time I see you on the screen talking to Saskatchewan residents about the health protocols that you were encouraging them to follow. It's been extremely helpful and extremely necessary. So once again, thank you. My questions will primarily be to Dr. Shahab and Dr. Worker. Dr. Shahab, you talked about this liaison committee that was established and met monthly starting in June, the committee that consisted of Dr. Boda from Alexis, Saskatchewan, yourself and Dr. Worker, and the House leaders of the two main political parties. And during those meetings, I suppose you offered advice as to health protocols that you would encourage the two main political parties to adhere to during the upcoming campaign. But I'm curious as to why some of the other Saskatchewan political parties were not involved. Now, I understand that the call of Dr. Boda was the one that everyone listened to. In other words, he was the one who formalized this committee and invited representatives from the two major political parties. But there are 5 political parties that were campaigning in Saskatchewan: the Greens, the Liberals, and the New Buffalo Party. And in fact, the Buffalo Party, which is an extension of the Wexit, or now called the Maverick Party, which is a Western separation political entity, actually finished second in 4 of the Saskatchewan ridings. I am curious, Dr. Shahab, if you felt confident that the advice you were giving to the main 2 political parties was being transmitted to some of the other lesser-known political entities in Saskatchewan.
Thank you. I think that's an important question. I think the chief electoral officer convened that table, not me. But from my side, if they had asked all political parties to come to the table, I would not have had any concerns. But I agree that was an important table to forecast what we would see, what we are seeing, and to address any issues of concern.
So just to recap, I'm trying to make sure that I ring fence this and get accurate information. Are you saying that you were satisfied that the information and advice you were giving to the two main political parties in Saskatchewan was also being transmitted through Alexis Saskatchewan to the other 3 smaller political entities? Were you confident and satisfied that your advice was being trickled down so that all political players would have access to the same advice?
I would think that those discussions and other discussions would inform the protocols for conducting elections. So yes, I would say a lot of that advice was translated into both public health guidance for pre-election activities and also election Saskatchewan guidance for conduct of voting.
So I want to talk just a little bit about public awareness campaigns. I asked this to Dr. Boda when he was here. He seemed to indicate that any public service announcements or campaigns, awareness campaigns to assure Saskatchewan people of the safety of residents going out to vote in person should primarily be the responsibility of Saskatchewan Health. Do you agree with that? And if so, what plans did you implement, if any, or what plans would you envision in the future to try and encourage and educate residents of the province that there is safety in actually physically going out to vote at polls?
So I think in public health, our advice is general but also sector specific. But while I would agree with Dr. Boda, I understand they also had specific advice on their website and through social media about how to vote safely. So it was complementary. If they had asked us to do a lot that we could have done, but it was complementary and there was no duplication. So their specific advice about safe voting was done by Election Saskatchewan in Saskatchewan.
Thank you.
Thank you, Mr. Lukwiski. Next, we've got Dr. Duncan, please.
Good morning, everyone, and thank you for your expertise, your experience, everything you've been doing to keep Canadians healthy and safe. We are grateful. And I have a limited time this morning, so I'm going to ask for short answers, often only a yes or no, if I may, please. To Dr. Shahab, would you agree that other provinces are in a second wave of COVID-19? Yes or no, please?
Yes, some are.
Thank you. Do you believe the recent surge or the recent increase in your province to be the first wave in your province? Yes or no?
Yes, and predictable because of people moving indoors.
Thank you. Do you believe that you were in the first wave during the election? Yes or no?
No, the cases rose just towards the end of the election and after the election.
Thank you so much. During the election, did you have only localized outbreaks? Yes or no, please?
Only localized outbreaks.
Thank you
Yes,
very
yes.
much. During the election, what was the range of coronavirus cases that you had, and what was the average number of new daily cases? Could that information be tabled with the committee? Yes or no, please? Thank you.
Yes, it can be tabled. Sorry.
Thank you so much. Did you have outbreaks in long-term care during the election? Yes or no, please?
I'm not aware of specific outbreaks during the election.
Thank you. And I know we've talked a bit about this, but could you table the guidance for long-term care with this committee, please?
Yes.
Thank you so much. Were there outbreaks in any other congregate settings during the election? Yes or no, please?
Not in congregate settings, but outbreaks in small clusters were happening.
Thank you. Did you have guidance for other congregate settings, please?
For personal care homes, yes.
Could that information be tabled with the committee, please?
Yes.
Thank you so much. I'm wondering if you could table with the committee the range of coronavirus cases and the average number of new daily cases for the major, for Saskatoon, Regina, and Prince Albert, please.
Yes.
We know that in a community, you don't have the same level of positive tests. Did you see a range in a community of positive testing? Yes or no?
Yes. Yes.
Thank you. Could you, to whom I'm really was interested in the IPAC specialist, to whom to the IPAC specialist report, please?
They were to Election Saskatchewan, but they were linked to medical health officers and environmental health consultants in my office.
Could you provide the org chart that looked like and the roles and responsibilities of the IPAC specialist, please?
Yes.
Thank you so very much. I'm grateful. If I could go to Dr. Russell, during the election, what was the range of coronavirus cases that you had in New Brunswick? What was the average number of new daily cases? And could you table that with the committee, please?
Yes, I can.
Thank you. That's fine, Dr. Russell. Thank you.
Are you going to be submitting these in writing? Because I'm not taking notes, but I can take notes.
That will be provided. Thank you.
Okay, great.
And during the election, if we could know what was the range of coronavirus cases you had and what the average number of daily cases was, for example, for Moncton, St. John, and Fredericton, would you be willing to table that with the committee?
Yes.
Thank you. I have one last question for you both. You're both so gracious. You both, Dr. Shahab, you talked about contact tracing and signing in. Would you be worried in a location where you may be doing the contacts, but there's no contact tracing happening in the location, in the city, please?
We work with local public health, so we would not expect that to be a situation. It has not arisen so far.
But would you be
I
concerned?
would be worried. I would be worried, yeah.
Thank you very much. Thank you both.
Thank you. Next, we have Madame Normandin for 2.5 minutes, please.
Thank you very much. Dr. Shahab, I'd like to come back to something you said earlier on. You said that one of the important criteria for holding an election was trust on the part of the public. Now, we've seen what has happened in the United States, and we've seen here too that sometimes cities and rural areas vote differently. Have you considered the possibility that there may be outbreaks in cities? People are afraid and therefore vote less. And perhaps that rural regions might vote more because they aren't as afraid.
If it was a big difference between case rates in different parts of the province, that may impact how many people chose to vote by mail or how many people actually turned out. That can have an impact.
Peut-être,
Dr. Russell, do you have anything to add? Well, we didn't have cases, and we didn't have those kinds of outbreaks, so I can't really tell you. But it's true that perhaps in rural areas, people's behavior would be different depending on the situation. But I think, as Dr. Shahab said, there are opportunities for mailing in ballots. Thank you very much. I'd like you to speak to us about long-term care facilities. I know you'll be tabling documents, but I'd like to know whether there were stricter measures in these long-term care homes and whether more staff were required as well. Well, for the elections, the only thing that was possible in long-term care homes was mail-in voting because we did not want to increase the risk level. Dr. Shahab.
Like Dr. Worker described, there was a need for certainly more coordination. And I would estimate that Elections Saskatchewan did have to have more staff available for that process.
Mais je comprends que les règles.
Well, Dr. Shahab, I know that there were stricter sanitary measures being taken in long-term healthcare centers, were there not?
Yes, but we already used to do that during influenza outbreaks. And so the process was established. It was just done again more methodologically for all long-term care facilities, irrespective of any outbreaks of influenza or COVID.
Thank you, Dr. Shahab. Mr. Blakey, 2.5 minutes.
Thank you very much. Dr. Russell, I wanted to ask, in your opinion, does a longer RIP period help contribute to being able to better deliver an election that is safe from a public health point of view?
I can't really see the length of time of the RIT period affecting the safety of an election with respect to the public health measures that would be in place throughout.
Okay, and Dr. Shahab, I know you had answered this question already. I'm wondering, because you had focused in your answer or put emphasis on the importance of pre-election activities, I'm wondering if, in the event of a snap election, if a longer RIT period, in your opinion, would help, mitigate any challenges that might arise from not knowing in advance when the election would begin.
It's hard to say. I think whatever the RIT period is, all activities must be safe, and even before the RIT.
Okay, thank you both very much.
Thank you. We've got about 10 more minutes of questioning. Next, we've got Mr. Doherty and then Mr. Drouin. And then we have Ms. Elizabeth May that has joined us for this meeting some while ago. So since we have a little bit of time, I was wondering if everyone would be okay if we gave Ms. May a round at the end as well. Okay, so we'll move on with Mr. Doherty right now for 5 minutes.
Mr. Shahab and Ms. Worker, could you please table with this committee your door-to-door voting protocols?
These are not our protocols. They are the Elections Saskatchewan's protocols.
Yes, Dr. Shahab and Dr. Worker. Yes? Is that correct? Am I right? Or sorry, not Dr. Worker, Dr. Russell. Someone. Anyway.
Hi. Again, same as Saskatchewan. The protocols are part of Elections New Brunswick. We provided advice in writing, in terms of our public health advice, but their work plans and protocols, their operational plans rather, and protocols were set by them.
And Justin, correct me if I'm wrong. I think that we have already asked for those protocols from Elections New Brunswick and Elections Saskatchewan. Is that correct?
Madam Chair, I believe that is correct. In the information that was asked, that type of information was also requested of them.
Okay. My next question is directed to Dr. Shahab and Dr. Russell. Do you believe that in-person polling locations were safe for people to vote in person?
Yes.
Yes.
Dr. Worker, same question.
Yes.
Did either of you, and I think this question has been asked a number of times in different ways, but I just want to confirm what measures were taken by both the Public Health Office, Ministry of Health, and Elections Saskatchewan's Elections New Brunswick to convey or message to your population or to the electors that voting in person was a safe option?
So my understanding, and actually I did see many of those ads, print media, social media, other media about Elections Saskatchewan, detailing all the processes and how it's safe to vote in person, but also the opportunity to vote by mail.
Do you have any anecdotal evidence of any complaints in Saskatchewan at polling stations?
I'm not aware.
I'm just going through my notes. I think you guys have both gone, or have you gone over them? I'll yield the floor, Madam Chair.
Okay, Mr. Drouin.
Thank you, Madam Chair, and I too, at the risk of repeating myself, but I also want to thank you, and I've certainly watched all of you operate in your own provinces, and even though I'm from Ontario, it's in all of our interest to see all Canadians do well and succeed and be healthy. I'm interested in the governance and how the relationship with Elections New Brunswick, and perhaps I could start with you, Dr. Russell. I know the writ was dropped on August 17th. That's that's just the fact. And I'm wondering, did Election New Brunswick reach out to you prior to the writ being dropped, or did they reach out to you on the 17th and said, "Oops, now we've got an elections coming. How do we prepare to make sure we can have elections safe?"
Yeah, they did reach out ahead of time, but I don't know how far in advance. Again, I think the idea of safety of elections in terms of public health advice, with each phase of our recovery and with each new onset of different things that we're going to be opening, we would take on that as a chunk of work. So when it was time to work on the schools, we had all of the guidance documents ready for how to have school open safely. For elections, that was just another piece of that work. But they definitely reached out to us in August. I just don't know the exact date.
Okay, and would there have been a lot of back and forth? Elections New Brunswick would propose a plan, and then you guys would provide your input, and then we've heard Dr. Shahab said that perhaps there should be more polling locations. Is that something that your organization advised as well on that?
My understanding is there was a lot of back and forth and input. We gave them our advice, and then they came back to us with their operational plan, and then we helped them improve that operational plan to make it as safe as possible.
Okay, thank you. Dr. Shahab, I would ask the same question to you with Saskatchewan. Were you involved before the writ was even dropped to provide advice on elections?
Yes, we had a strong relationship with the Elections Saskatchewan, for prior elections and by-elections, and our first contact was made in end of February, when we knew that there would be an election in 2020, likely in October, and so we had started working closely together since then.
Okay, and was there, my colleague, Mr. Lukiski touched on it. You had convened the two major parties, and I know hindsight's 2020, but would you advise, if Elections Canada does provide advice to parties, to ensure that all parties are at the table to make sure that they have the same information and can practice healthy and safe elections?
So the table was convened by the CEO of Elections Saskatchewan, but yes, I think opening that for all political parties can only be of benefit.
Thank you. And one final question I would ask. Public Health Canada is probably going to be giving the advice to Elections Canada, but Public Health Canada flies at 10,000 feet, so I imagine, would you welcome input from each of your own provinces on how to conduct safe elections, even though they may be federal?
I think likely input and support would be required with the coordination of all public health jurisdictions, federal, provincial, and of course local.
Great, thank you.
Thank you, Mr. Drouin. Ms. May.
Thank you, and I thank the colleagues on the committee for giving me this opportunity. I've been keenly, well, all of the committee observations have been very, very helpful, and all of the witnesses that PROC has been calling this last while to look at the connection between holding elections in pandemics and how it can be done safely. I wanted to ask Dr. Russell, and I hope I don't put you on the spot, but do you think that voters in New Brunswick got the impression that when the Premier said he'd spoken to you, that he'd actually obtained your advice as opposed to just enjoyed speaking with you?
Well, I think because I represent public health, again, I can't put words in the Premier's mouth, and certainly anytime I was asked about what my role was in the election and decisions around it, that the only input that I really had was how to do it safely. Obviously, you know, if you're going to try to reduce the risk to zero, that's impossible. But certainly, you know, obviously reducing the risks no matter what the outbreak situation is and no matter how many daily cases you have, obviously does change the risks. And we can't ever make them zero. But obviously in our Atlantic bubble, where we've been successful at keeping our case numbers low and keeping our outbreaks small and short, we did have the luxury of having a low risk setting to have an election. So, you know, our experience is going to be very different from what the federal experience will be, in the sense that it's hard to predict where the second wave is going, when it's going to peak. The projected numbers right now is that by mid to late November, the cases in Canada are going to go up to 8,000 per day. And with the global risks increasing and lockdowns happening in Europe and England, again, it's hard to say when things are going to change in terms of the risk setting, that the backdrop in which you'll be having to make those decisions. But certainly we would never say whether to have an election or not. We would just say this is how to make it as safe as possible, knowing that with COVID-19, the risk will never be zero in a global pandemic.
Yeah, thank you. And certainly New Brunswick's right. I know that at the point that the British Columbia snap election was called, I went and looked at the rate numbers, and British Columbia's incidence of COVID at that point was 6 times higher than New Brunswick's. So New Brunswick going first in some ways, and this might be more of a political question, but I'd like to ask both Dr. Shahab and Dr. Russell, do you think the fact that New Brunswick went first with a very low COVID rate led to any misperceptions in other jurisdictions that it's relatively easy or safe to hold an election in a pandemic?
Do you want me to go first?
Yes, thank you.
So again, communications is a really big part of what happens in any crisis management, and evidence-based, transparent, up-to-date information around risks and what behaviors people have to do to keep themselves and their communities safe is very important. And here in New Brunswick, again, we have the luxury of having a low number of cases due to a lot of hard work and a lot of protocols that are in place around our borders in the Atlantic bubble. I don't think people have a false sense of security. I hope they don't, around what it means to have an election during a pandemic. All we can do is make the risks as low as we possibly can, knowing that, again, the risks will never be zero. So I think if it's framed properly from a communications perspective, people will understand that. And again, the democratic process probably does take precedent over all of the other issues at this time, but again, I think with proper communication, the understanding and framing of those risks can be done properly.
And there's just one other, in getting, this was a Saskatchewan question to Dr. Shahab. I know that the leader of the Green Party of Saskatchewan, who's a friend of mine, and thanks to Tom Lakuski for raising that there are other parties in Saskatchewan. I know she was personally collecting the signatures for many of her candidates who didn't own automobiles. There are a high proportion of the candidates that ran for the Green Party in Saskatchewan who didn't own their own cars. The leader was out there collecting signatures for them and having to knock on many doors to get people to sign up so that they could run. Were there any protocols in place for that aspect of the election campaign, collecting the signatures to get names on the ballot?
So we had guidelines in place since June, end of May, June, for door-to-door canvassing activities. So the cautions that were outlined there would apply to any such process.
Thank you. Thank you very much, Madam Chair. I will also, if I get any information from Ms. Hunter as to what she observed in the election, I'll pass it on to the committee.
Yeah, absolutely. It would be helpful for anyone who's ran in a provincial election or a by-election. So thank you to all of the witnesses today.
Point of order. Point of order, Madam Chair.
Yes, Mr. Doherty.
Is it possible just to ask one short question to the witnesses, just one last one?
Yeah, I mean, I think you let go of some of your time, so I'm sure it would be okay with the committee.
It's just following up. It's just following up from what Mrs. May brought in, and I think others to our witnesses. Are you consulting? Did you consult with other jurisdictions in best practices, and are you continuing that? So it goes to all witnesses.
Dr. Shahab?
So I think we had been planning since February. We did not formally consult with New Brunswick and BC, to my knowledge. I think elections, Saskatchewan may have connected horizontally, but obviously we do look at each other's protocols and guidelines and learn from them all the time, and all our guidelines are posted online. Thank you.
Okay, so no formal discussions though.
Dr. Russell?
Yeah, no, not to my knowledge. And again, the basis of our public health information and guidance is ultimately from our conversations with the Special Advisory Committee and Public Health Agency of Canada. So all the evidence-based information that we use to base our decisions on in each jurisdiction comes originally from Public Health Agency of Canada and our discussions with the Special Advisory Committee, which includes all the Chief Medical Officers of Health for the entire country.
Great, thank you.
Thank you. So thank you, Dr. Russell, Dr. Worker, Dr. Shahab. It was a real pleasure having you provide your feedback and testimony today. At this point, the rest of the committee is going to move into some committee business, but you are free to log out and obviously go back to the busy day that you have, I'm sure.
Thank you for the opportunity. Thank you.
Thank you very much.
And yes, no questions are very hard.
Okay, take care.
I know they're hard for us in politics as well. We like to elaborate. Okay, hold on, just need to plug in my computer. I'm about to die here. But for committee business, I just wanted to go over the plan that was proposed by the subcommittee. I need to have it approved by the full committee. And so there was a report that was put out listing about, I think, 11 different decisions that were made by the subcommittee. I wanted to first let you know that some of those suggestions may not be possible at this time, but most are. First, the very first one that we have is, actually, let me jump to suggestion number, the committee schedule an additional meeting beyond its usual complement meeting. So number 4, we suggested that we have an evening meeting on November 18th. That is no longer possible because of the resources that are being used. We're not going to be able to have a meeting in between our meeting of, originally we were thinking in between our meeting of the 17th and the 19th, which is already scheduled for main estimates. We were going to have an evening meeting on the 18th. That was decided by the subcommittee, but the clerk has informed me that that is no longer possible because the whips have all decided that they're going to allow the other committees to have 2 meetings each a week. And because of that new allowance, we're not going to be able to take that time slot. The other committees are going to have it. So, but I think we can still get quite a lot done. We will be able to still do the meeting next week during our constituency week. So the rest of it all pretty much remains the same, other than 2 more things, I guess. We preferred to, and I think a whole bunch of members had said that they preferred the 10 to, I think it was Mr. Doherty mainly, the 10 to 1 time slot. That is also not possible. It can only be 11 to 2. So I think we're just going to have to deal with that and have our meeting 11 to 2 whenever we need to have the 3-hour meeting. And then if somebody needs to get a substitute for that last hour, they will, I guess it will be on them to find a substitute for that 1 hour that they might not be able to make it. So there was a couple of meetings that we had established that we needed the 3-hour time period for. One was in particular the one where we're going to have the House Administration, Protective Services, and the speaker in. That's going to have to be a 3-hour meeting. And then there's some other witness meetings that are going to have to be 3 hours so that we can get 3 panels of 60 minutes in. So those, whenever those occur, they will be from 11 to 2. And also to Justin, I wanted to let you know that I did get an email while after this meeting had started, and apparently the availability of Minister LeBlanc for the Privy Council is for the 17th. He said that he can make himself available for the 17th. So I was wondering whether the committee would have a problem with just flip-flopping the 2 days and having the meeting of the 17th with the Privy Council, the President of the Privy Council, and then having the meeting of the 19th with the Speaker and House Administration. We're just flipping the 2 days. That's all that would be done there. Would that be okay with you, Justin, first, and then?
Yes, Madam Chair. I can talk to the Speaker's office and Elections Canada about seeing if they can come in on November the 19th. I'll definitely confirm with them and reschedule them for the 19th so that Minister LeBlanc could come in on the 17th. And I would
that the 19th would have to be the meeting that would be 3 hours long, so it would have to go from 11 to 2.
That's correct. So if that works for all of our witnesses, the meeting on the 19th would go from 11 to 2 with the Speaker and the House first in the first panel, followed by the Chief Electoral Officer in Elections Canada in the second panel. And then November 19th would be a 2-hour meeting from 11 to 1 with Minister LeBlanc and senior officials from the Federal Leaders Debate Commission.
Madam Chair, Madam Chair, I've got a question. I hope I'm not interrupting the flow of your discussions.
No, I'm pretty much done. Everything else is the same.
Sure.
So now, whatever questions you guys have.
Yeah, this kind of falls in line with the fact we're discussing the subcommittee report anyway. I'm just wondering if we could agree as a committee, even though perhaps the subcommittee should be the ones really technically dealing with this, but the report on prorogation has been tabled in Parliament, and we had been talking about previously getting that report and either engaging in a study on it or at least allowing the committee to have a meeting devoted to that report and having discussion, bringing forth witnesses, that type of thing. Are we able to find any time so we can actually get that discussion and that study on the agenda?
So the subcommittee did decide on that as well, and I believe you will find it under number 11 of the subcommittee report, that the committee, upon completion of its study on the conduct of a federal election during COVID-19 pandemic, initiate a study on the document tabled in the House pursuant to Standing Order 32.7 and referred to the Committee on the Government's reason for proroguing Parliament in August 2020. So it was decided there that once we complete the study and from what we have slotted into the calendar, it looks like we will be able to complete the study sometime in early January, and then we would carry into the prorogation study right after that. The interim report, which was due originally by the committee's self-imposed deadline on December 11th, that was decided by the subcommittee in bullet number 8 of, oh, sorry, not 8, bullet number 7 of the subcommittee report, that deadline would now be changed to December 11th instead of the 1st. And so we would be able to get in the main estimates, we'd be able to get in the bulk of the witnesses needed for which testimony would get cut off for the interim report, I believe, at the meeting of what was going to be the meeting of the 18th, but we won't have that meeting anymore. So I know this is very confusing to everyone else, but I'm wondering if your colleagues that sit on the subcommittee, if they probably filled you in a little bit about hopefully what was decided. And
Madam
then the
Chair,
rest of the witness testimony would continue. Yeah. For the final
perhaps for clarity's sake, if nothing else, and to put a little precision on the timing of our discussion and study of the prorogation report, rather than just say, as the report that you've delivered to us states now, that we get into that at the completion of the study. If we were able to say at the completion of the interim report, that might be a little bit more precise in timing as to when we can actually get a hold of that report in terms of discussing it at this committee. I guess what I'm saying is I just don't think it would be in the best interest of this committee, if we really do want to discuss that prorogation report, that we leave it as open-ended as it is now, just by saying at the completion of the study. If the study is never completed, we'll never have an opportunity to discuss that report.
Yeah. Madam Chair, if I might as well too, if you remember it during our meeting, we did suggest, and I think Mr. Blakey also suggested it as well, is that it would be good to, for scheduling purposes, to at least put a placeholder in a date placeholder when we would start this, and we would get some assurances that the elections report's not going to be, the never-ending report, that we would be able to get to the prorogation report. So I suggested at one point, can we at least look at a date where we can say confidently we will begin the prorogation report.
Okay, Mr. Blakey, and then Ms. Vecchio.
Yes, thank you. I am on a different issue in the sense that while I agree with what's being said about maybe targeting a date in the calendar for the beginning of that, it's not what I intended to speak to. So I don't know, Madam Chair, I'll just defer to you if you want to conclude that conversation first before proceeding to another matter, or if you want me to just kind of put what I have to say out on the table.
Yeah, just put it out on the table, I think, at this point.
So just quickly with respect to item 6, which I quite like, I just note that it's the 4 recognized parties that would be asked to give a written submission. And I'm wondering, when we were talking about having a panel, the question arises, how many people are going to be at the table and how unwieldy may that become? I think in light of the fact that we're asking for written submissions, I don't see why we wouldn't extend the invitation to all registered parties with Elections Canada. There's about 20 or 21 of them. That's, I don't know that they'll all get back, but I don't see a reason not to have the benefit of their input, considering that it's not just parties who are recognized in the House who have an interest in the conduct of federal elections.
Okay. Yeah, there are a lot of parties that are registered. We might get a whole bunch of information from parties that are maybe not as active in the electoral process. So it's up to the committee really, but
one possible option for the committee, if the committee really is concerned that it might be too much, would be to invite parties that are registered with Elections Canada and have at least one representative in the House of Commons to produce a written submission. I'm happy extending the invitation to all of them. That would be my preferred position. But if there's concern about the magnitude of that request, that might be a suitable option B in the eyes of the committee. So I put both out there for the consideration of the group.
That's great. Thank you, Mr. Blakey. Okay, Ms. Normandin's not on the list anymore. Ms. Vecchio and Mr. Turnbull.
Thank you very much. I just wanted to add in a couple things. One thing that I'm aware of that just came in, we will be having Minister LeBlanc on the 17th now, and there was the talk about others, but seeing here is on the 19th, if we're switching things. The House of Commons staff, they may be at estimates on behalf of the Board of Internal Economy on the 19th. So I think we need to look at what their availability is there. So we may have to switch a couple of the things, just not that. So perhaps we can give Ruby the opportunity to switch as she needs. Another question that I had specifically was on witnesses. I think we put in the majority of the witnesses that we have wanted to see. I know I see Dr. Tam is listed on here, that is still another person that's outstanding. But when we're talking about the time frame, what are our expectations and what we want to get out of this study? We have had some excellent people come here as witnesses, but what is it that we're trying to get from this study, and when is that date that we want to actually drop a full report, or is it going to be really the interim report is going to be the speaking? So I think we really do need to see how many more witnesses are we expecting, and what is going back to the motion, what are our guiding principles to getting a report out there as well? Thank you.
So we have, the clerk is working on inviting other groups that have some vulnerabilities throughout this pandemic. So we do have panels we're lining up. We had agreed at the subcommittee that one of our next witness-heavy meetings would be with a panel of Indigenous witnesses and seniors and I believe long-term care. And so we're trying to slot in most of those witnesses, and my goal, I guess, I don't know if this is a direct answer, is really to try to get in all of our witnesses before the winter break, as many as possible. And then we maybe, what we had discussed at the subcommittee is at that point we see where there might be a few gaps left. And if there's a few more witnesses that we need to hear from, we hear from them quickly at the beginning after the break, winter break, and then do work on our draft report and basically have it tabled as soon as possible after the break. That's the conversation that happened at subcommittee, and that is why we've also in this report you'll see we've asked New Zealand to just submit written submissions and the parties so that we can decrease the amount of time it will take to have in physical witnesses before the committee. We've got quite a good list to fit into the groups that face challenges. And so I think it can get done. I really do see we have lost one meeting time slot, but I still think we can get it done.
Did we, Madam Chair, can we just bring it back to the prorogation report again? Mm-hmm. Can we agree today with the committee on a definitive start date, or as Mr. Lukiski said, once we've got the interim report and we know where we're going, is there a time that we can slot in a short meeting, where we can start the discussions on the prorogation, knowing that the full discussion's not going to, the fulsome discussion and hearing's not going to start until after the elections report is finished.
Okay, so I guess my question to you is, would you like that meeting before the winter break or right after the winter break? Because before the winter break, I've got some challenges because I'm not allowed to really, extra meetings was going to be our saving grace, but right now I'm hearing because all committees are allowed 2 meetings each, extra meetings are not in the future for us.
Well, I would put it to the committee. I think there is some. I think we're okay with moving the bulk of the study, and I conveyed this during our committee meeting, is that pushing this into January, February, this elections report is very serious, but can we start the discussions about potential witnesses and what have you? Is there, whether it's at the end, tag it on at the end of one of these studies, because we are nearing the end of our witnesses. Let's at least start the discussion, and then we can frame out the rest of it as we get back from Christmas break.
So perhaps I can tack on another committee business meeting wherein we discuss, our preliminary discussion about what witnesses and time length of that study. We could probably do that.
Right.
Mr. Turnbull and then Mr. Blakey.
Thanks, Madam Chair. Appreciate the conversation. I've got some things to share or thoughts to share on both of the points. I think with regard to the current study, I really feel based on the witness testimony that we've heard is there's a large amount of importance being placed by public professionals and elections officers on mail-in voting. And I know that many constituents and other
Could you please put your headset on, Ryan?
Oh, I'm so sorry. I actually forgot that I had taken it off.
I know.
It's the hair.
I find my ears get really hot if I wear it. How's that?
That's great. Yeah, if you could repeat that. Thank you.
Apologies. My apologies to everyone. So just a few thoughts to share on both points here. With regard to our current study on elections in a pandemic and doing so safely, I really think we've heard quite a bit of testimony that has placed importance on mail-in ballots and that process. And I've heard from quite a few stakeholders in my riding that process can be quite clunky and present challenges for people. So I think from my perspective, it would be great to have some more witnesses that can speak to how we might streamline that process. I think it would be very useful for this study. So I do think there's additional witnesses I certainly would like to hear from. I also have other colleagues that I think may have other witnesses in mind for other topics that are relevant for the current study. In terms of the timing, and I obviously wasn't at the subcommittee meeting, but I did look at the report. In terms of maybe with regards to the prorogation report that's been tabled and referred to us, maybe we set, this is just a suggestion, maybe we set a definitive end date for our current study, because we've only set a date, as I understand it, for the interim report, but not for the end of this study itself. So perhaps if that's sometime in January, then the prorogation report could begin after that. That would be my thought on it, so we can get what I think is extremely, I mean, all things are important, but I think the elections report and the recommendations that members of parliament on this committee will make are pretty important to get out there. So that's one thought, and that's two thoughts. The third one is just in terms of the standing orders and what PROC's role is in terms of a prorogation report. I would really find it helpful to hear perhaps from the clerk as to what are we required to do, because my understanding based on my reading of the standing orders, we're not required to do a study on a prorogation report. It's just that we have the opportunity to review it. So I just wondered, what we're actually required to do, and if there is a requirement there, what specifically it is. That would be helpful for all of us.
Yeah, Madam Chair.
We've got a speaking order still. We've got Mr. Blakey and Mr. Algabra, and I think we're running low on time. So if I could quickly hear from them, and I think we could sum this up. I do think we have consensus on mostly everything. And in terms of what's required, we could probably talk about that at whatever time slot we pick in the next committee business portion of our meeting to talk about prorogation. We could hear from the clerk and get into what would be required, what the committee could do, who would hear from. So I will, in terms of that first issue that Mr. Lukowski you had brought up and Mr. Doherty, if you leave it with me, if you trust to leave it with me, I will slot in a time that I think would work in the coming days, where I think we only have, like today, about 90 minutes of witness testimony, and then therefore we can have 30 minutes of committee business on that day.
Yeah, my only point very quickly to Ryan's question about what is the mandate of PROC. Let's not forget, if something is referred to our committee, we are obligated to deal with it. So I would just like to be able to, that's why I'm trying to get at setting a date, firm date, so that we just don't let it go by the wayside.
So if maybe that the next meeting, I can get you a firm date as to where. Right now I'd have to sit and look at what witnesses are falling into which days. And if we have 3 hours of witnesses, I obviously wouldn't pick the 3-hour day. I would pick the day where we only have, less witnesses that have said they're coming in, leaving us with some time to set aside to discuss the prorogation study and to plan for it. So if you allow at the next meeting, I can probably give you a better picture of what date we could put that on. Is that okay, Mr. Lukowski and Mr. Doherty?
No, it's fine. If we can deal with it timing-wise by the next meeting, Madam Chair, that's fine. I have infinite trust in your wisdom and your judgment as to giving us an appropriate date at the next meeting.
And the date will be within, the next few meetings or whatever. Within December, before we break, basically, we'll have that discussion. We'll set in place a timeline for that study, and hopefully maybe even have a timeline for finishing this study that we're on right now.
Excellent.
Mr. Blakey and Mr. Alghabra.
So just to say, first of all, I'm satisfied with that solution on the question of getting some more clarity around the timing for looking at the prorogation report. Second, I am aware of the time, and just wondering if there's a sense of the direction for the clerk on the question of which political parties will be invited to submit written remarks.
We have Mr. Alghabra next. Maybe, I don't know if he has remarks to make about that, but that might help.
Madam Chair, no, I wasn't necessarily going to comment. I have no objection to, in fact, I support the idea of inviting political parties and to offer their plans. And I was also going to like to add the importance of inviting Canada Post. We are watching what's happening in the United States. We know that, and Elections Canada Commissioner spoke how he expects 4 to 5 million ballots to arrive in the mail if there's a general election. I think it would be really important for our report to include first our own insight on how Canada Post is prepared, and also provide advice to Canada Post on how to be even more prepared. So I'd like to suggest that we invite Canada Post.
I think that's an excellent suggestion. If all the parties would like, maybe over this constituency week or by the end of it, if there are other witnesses that are popping up that you would like for us to add on to the list, please email me who those witnesses are, so that we can start slotting them in. And of course, don't be liberal with your list, like really pinpoint what testimony we're needing at this point, and then let me know who that is, so we can add them in. So be very.
How can we not be liberal?
Madam Chair.
Don't be conservative this time, Ryan. Be conservative. Yes, Mr. Doherty.
I believe that Canada Post is on our witness list, has been as well too. I think it's so important. Thanks.
Yes, it is on your witness list. You're correct. Okay, so in terms of Mr. Blakey's suggestion, maybe I could just have hands. We have two options. One is to invite every registered party with Elections Canada, and the other is to invite registered parties that have at least one representative in the House. So all in favor of every registered party, if you could just raise your hand. Okay. All in favor of every registered party that has at least one member representative in the House? Okay. So it is the latter, and we have made note of that, and I think that resolves that. And so at the next meeting, I will let you know which meeting will have a committee time set out in which we can discuss the prorogation issue. And is everyone in favor, I guess, of the amended? How would this work, Justin, since we've made some amendments? We're switching around prong 1 and 2 in the committee report. Prong 4 would no longer exist because we don't have that time slot, but the rest of the report seems to be all accurate. So does the committee approve of the report with those minor changes? Okay. Seeing as there's no opposition, then me and the clerk will get working on scheduling those meetings and getting the witnesses that we need briefings from to the committee. Thank you. Bye, everyone. Have a great day.